While Trump, in a series of tweets and press comments, had made his opinions on the drugs chloroquine and hydroxychloroquine well known, the nature of his behind-the-scenes intervention has not been previously reported. The guidance, published by the Centers for Disease Control and Prevention, has received scant notice outside medical circles. The episode reveals how the president's efforts could change the nature of drug oversight, a field long governed by strict rules of science and testing. Rarely, if ever, has a U.S. president lobbied regulators and health officials to focus their efforts on specific unproven drugs. Administration supporters say the CDC document, highlighting options, makes sense at a time of medical calamity with no proven treatment. And, they note, chloroquine and hydroxychloroquine have been prescribed for years with known risks. Any potential risk to coronavirus patients, some argue, is worth taking given the health crisis. In a perfect situation you would never do this, said a public health specialist who recently left government. But if you know what the safety downside is, and the patient is ready to try it, it's worth a try. Trump did not raise his voice or express anger, but did emphasize the urgency of fast-tracking access to the drugs, the other source said. A cascade of federal action soon followed to make the drugs more available, including the federal government's grant of emergency authorization to supply them nationwide. An NIH spokeswoman said the agency was not the source of the content of the CDC-compiled document. The CDC said it presented the guidance to doctors at the request of a coronavirus task force, which urged prompt action. The first official action came March 21, at the height of the president's efforts, when the CDC prepared a document, Information for Clinicians on Treatment Options for COVID-19 Patients, that included a section on the anti-malarial drugs. The document describes possible prescription information for coronavirus patients, while at the same time proposing hydroxychloroquine and chloroquine as an option in coronavirus treatment. It was the first time the federal government's disease control agency had officially floated the idea. Although optimal dosing and duration of hydroxychloroquine for treatment of COVID-19 are unknown, the document says, some U.S. clinicians have reported anecdotally about different hydroxychloroquine doses. Flyer, the former Harvard dean, agreed. It's kind of offering these drugs up and suggesting that doctors might prescribe them when it's obviously not established whether or not they are effective or harmful, he said. The CDC declined to detail the interactions of its director, Dr. Robert Redfield, with President Trump. In a statement, the agency said the guidance was prepared at the request of the Coronavirus Task Force and doctors who requested CDC review the literature, compose, and post the information as quickly as possible. The CDC would not disclose the identities of the authors who prepared the document, nor detail its sourcing. The document said it was reviewed by the CDC's National Center for Immunization and Respiratory Diseases, NCIRD, Division of Viral Diseases. Trump's push for action came after Fox News on March 16 reported on a small French study highlighting the effectiveness of one of the drugs, hydroxychloroquine. Fox News interviewed a lawyer it said was involved, Gregory Rigano, who said, "We have strong reason to believe that a preventative dose of hydroxychloroquine is going to prevent the virus from attaching to the body and just get rid of it completely." In fact, the drug had not gone through an FDA review process by then. At the same press conference, FDA Administrator Hahn said regulators were taking a closer look. In a press release that day, the FDA emphasized it was merely investigating whether the drugs can be used to treat patients with mild to moderate COVID-19 to potentially reduce the duration of symptoms. Studies were underway, the FDA added, to determine the efficacy in using chloroquine to treat COVID-19. 2 days later, on March 21, the president personally pushed the health officials. The president also tweeted that the drugs should be put in use immediately. Trump, citing the study, promised that the drugs demonstrated a real chance to be one of the biggest game changers in the history of medicine. Meanwhile, the agency heads began publicly shifting their stance. After initially expressing caution, the FDA's Hahn on March 23 told Fox News host Tucker Carlson that preliminary data showed the drugs might indeed help treat the disease. Now, millions of hydroxychloroquine and chloroquine pills are on their way to the public, donated by drug makers, including Novartis Sandoz, Bayer, and Teva Pharmaceutical Industries Limited. The FDA issued an emergency authorization on March 28 allowing them to be prescribed and distributed from the Strategic National Stockpile. But they also expressed concern that the guidance may leave the reader free to interpret this information depending on their bias. We do think a document like this should more clearly state what this means for healthcare providers. Noting the president's tweets in their report, the authors urged the medical community and the U.S. government to send clear messages that include a proper interpretation of available data to counteract misinformation, including misleading statements or articles with clickbait material.